Hello, everyone, and welcome to today's webinar hosted by Engaged, the National Resource Center for Engaging Older Adults, which is administered by US Aging. My name is Meredith Hanley. I serve as the Director of Community Capacity Building at US Aging and oversee the Engaged Resource Center. Our webinar today is called Bridging the Digital Divide, Connecting Consumers to Technology and Engagement. And during the webinar, Older Adults Technology Services, OATS, from AARP, will highlight their work as well as share information on the affordable connectivity program and how the Aging Network and partner organizations can connect more consumers to affordable broadband. The Association of Assistive Technology Act programs, ATAP, will then spotlight State Assistive Technology Act programs and how Aging Network and partner organizations can work with these programs to connect consumers to assistive technology. And attendees will also hear from the Baltimore County Department of Aging on their events and tech support and training and other tools Baltimore County offers to connect consumers to broadband and devices, and how other organizations can create similar strategies. Next slide. So just a few housekeeping items. All attendees of this webinar are in listen-only mode for the duration of the webinar, but that does mean your microphone or phone will be muted, but there are still ways to engage, and I see many of you are doing this already. You can engage in the chat. You can also submit questions for the presenters at any time during the webinar by clicking the Q&A button at the bottom of your screen, and you can just type in your question to the Q&A box and click submit, and we'll plan to save time at the end of the webinar and get to as many questions as possible. And the webinar is being recorded and will be available on our website, engagingolderadults.org, in the next few days. Next slide. Just a few notes for accessibility and supports for those who are using a screen reader and want to silence any unwanted chatter in the chat and Q&A boxes. You can activate the speech on demand feature by pressing insert spacebar and then pressing the letter S on the keyboard. If you wish to view closed caption subtitles or watch a live transcript of the meeting, you can control that by clicking on the CC or closed caption button in the control bar at the bottom of your Zoom window. And if you'd like to notify us that you need technical assistance, you can raise your virtual hand in Zoom, or you can also chat me as a host of this webinar, and we will do our best to help you with that. You can also raise your hand in Zoom by pressing Alt+Y on the keyboard as well. Next slide. So I'll share just a little information about the organization I work for, US Aging. US Aging is the national association representing and supporting the network of area agencies on aging and advocating on behalf of the Title VI Native American aging programs. And our mission is to help older adults and people with disabilities live with optimal health, well-being, independence, and dignity in their homes and communities. And we have a number of initiatives that can be found on our website, usaging.org. We, in addition to the work of Engaged, we administer the Aging and Disability Business Institute. We co-lead the National Aging and Disability Transportation Center with Easter Seals. We lead the Dementia Friendly America effort. We operate the Elder Care Locator and the Disability Information and Access Line dial, among many more efforts. So again, you can check out our website for more information on any of that at usaging.org. Next slide. And by way of information on Engaged, Engaged is the short name for the National Resource Center for Engaging Older Adults, which is convening today's webinar. Engaged is a national effort funded by the U.S. Administration for Community Living through a cooperative agreement, and we work to increase the social engagement of older adults, people with disabilities, and their caregivers. And much of our work focuses on identifying and disseminating information about emerging trends. We develop various resources and related materials and compile best practice examples of social engagement programs. And we're guided by a project advisory committee with representatives from 18 organizations and resource centers who provide insights from their fields of expertise. And OATS, which is represented today on our panel, has been one of our key partners since Engage launched in 2017. You can learn more about our work at engagingolderadults.org, and I can place that link in the chat as well if it's not there already. And next slide just contains a little bit of our contact information, but basically, if you have access to our website, engagingolderadults.org, you can find all of the rest of the ways to connect with us from our website. But now I want to introduce our presenters. So we are joined by several great folks today. We will be joined by Alex Glazebrook, Vice President of Operations with Older Adults Technology Services, OATS from AARP, Ellen Forbes, Program Specialist in Digital Equity with OATS, Audrey Bush, Executive Director of the Association of Assistive Technology Act Programs, Linda Jaco, AT3 Grant Manager with ATAP, and Ethel Rasmussen, Manager of the Office of Communications with the Baltimore County Department of Aging. So with that, Alex, I will turn it over to you.
Oh, sorry, I was muted. Probably an embarrassing first start to the presentation, but thanks everyone. Great to be here and good morning. As Meredith mentioned, my name is Alex Glazebrook and I'm joined by my colleague Ellen, who will take over in a few minutes for the rest of the presentation. We work for Older Adults Technology Services from AARP or OATS. You may have heard of our organization as Senior Planet as well, because that is the brand and program arm of our work. So most of the things out in the community and the work we do online is all branded Senior Planet. Next slide, please. So I think we have a quick video here. I'm not sure if it will play, but if it does, it would be good to just kind of give a quick intro to our work and how our work affects the people that participate.
I'm a retired teacher. I taught school for some total of 34 years, and primarily I taught math. I could go online and check my email, or if I wanted to look up something, I would Google it. But in my personal life, for spending any of my time, I really didn't consider tech to be something that I wanted to spend it on. Senior Planet gave me the key to the door. Literally, it showed me the value of an internet connection, the value of creating a community and creating activities for yourself online. Because I was learning something, I was doing something, it's like I mattered. It's not just checking your email, checking the news, and checking Facebook. There's more to the computer, and there's more to the online community than that. I don't think I could have made it through the pandemic healthy and mentally, physically sound without Senior Planet.
So we like to play that video as just sort of a quick intro into our work and how technology can really broaden people's horizons. Next slide, please. So what I'm going to do on the next two slides is just sort of very quickly, because I know we don't have a tremendous amount of time, talk about where OATS came from and where we are now. And then before passing over to Ellen, I'll sort of overview the main ways that we're working and delivering programs. So OATS has been around since 2004 and began really doing very basic technology training out in local community sites. It actually started in Brooklyn, doing a lot of computer basics training. This is really when the internet was still fairly new. So we were kind of out on the frontier of this work with older adults. And as that work changed and evolved, so did OATS. And in 2013, we launched our first Senior Planet Center, which is basically our locations that help create spaces for people where they can think about what's possible with technology. So we do a lot of training and programming there, but we also have a lot of technology that's there for people to just experience and apply and test and fail and try again, because we think that there aren't a lot of spaces for older adults like that in the country. So we have 3 Senior Planet centers. There are 2 in New York, 1 in Denver, and there's 1 opening in Miami later this year. the work continued to grow. We were really New York City centric for a long time, but we expanded up into the northern reaches of New York in the mid 2010s, which is actually where I am right now in Plattsburgh, New York. And as our work grew, so did opportunities to kind of expand into other avenues of program delivery, which I'll talk about in a little bit. Next slide, please. And during COVID was really kind of when our organization made some pretty large changes, one of which is all of our programs that have been delivered exclusively in person for the first 15 or so years of the organization's history migrated online, as many of us did because of COVID. And that actually broadened our scale and reach really significantly and put us in communities that we couldn't be physically. And it's really, revolutionized our business, and I think a lot of businesses, but we're now serving and training and just interacting with significantly more older adults because of those changes. And the other big change, just to mention on the slide, is that in 2021, which was about 2.5 years ago, we became an affiliated nonprofit of AARP. So we affiliated with AARP, we joined forces so we could reach more people and scale our work, but still keep allegiance and fidelity to our mission, which is to harness the power of technology to change the way we age. And we really take that mission to heart because we don't really think of ourselves as technology trainers. We think of us, we think of our work and the people that deliver our work as conduits for change, and they're using technology as a tool to do that. Next slide, please. So very quickly, our work now is delivered in 3 main tranches. One is at Senior Planet centers, which I mentioned before. They are really beautifully designed, kind of think of them as Apple stores for older adults, but with way more amenities and programming all day and free coffee. And they're just places to hang out, build community, and learn. We also deliver a tremendous amount of work at partner sites. So we do that in 2 ways. We either do that directly with our trainers who are on our staff, but we also have a very large licensing initiative that is sort of like a franchise model where you can tap into our extensive curriculum and get the training and support from OATS that you need to deliver the work in your community where we are not located physically. So the licensing initiative is a really great way to tap into our work, get access to everything we're doing, and kind of take it out on your own with our support. And then finally, as I mentioned, we have a tremendous amount of programming happening every day online, where we're having somewhere between 40 and 50,000 interactions with people in programs every month. And it's really continuing to build momentum as the programs grow. Next slide, please. And then this just gives you a quick sense of how much, how the scale of the organization, this was last year's numbers. This has changed to being, our licensing sites now we have 300 sites in 26 states. And we'll probably engage with about 500 people this year online and in person. And we also run a contact center that is free with a nice 888 number, which I think we have on the next slide, allows people to call in and get support on basically any tech topics they may have, but also allows them to better interact with us and get connected to our programs. Next slide, please. And this is just overviews our online offerings because I think they're really important and a great option for providers to tap into. I don't think I've mentioned yet, but everything that OATS does is free to the older adult or the end user. So you could go on seniorplanet.org today and there'll be somewhere between 10 and 15 programs that you could join or your clients could join for free. It's really easy to get in. There's not a complicated registration process. And we have multiple languages. There's free videos, live programs, really compelling articles. There's a lot there and it's all free. And our hotline is open 9 a.m. to 8 p.m. Eastern, Monday through Friday, with the number posted there that people can call in and get support with basically anything they need. And they don't have to be a prior participant or they don't have to have interacted with us at all. You can just call the number. So our online offerings are a great option. Next slide, please. And now I'm going to pass it over to Ellen on my team, who's going to talk through more specifics about digital equity and all the great things we're doing with connectivity. Ellen?
Thank you very much, Alex, and hello to everyone. Thanks for having me here today. So I'm here just to quickly highlight some of the inequities faced by older adults when it comes to technology and ways in which programs like the ACP, the Affordable Connectivity Program, can, especially for low-income older adults. So this slide is an analysis that we did with our Aging Connected report in 2021. And in that report, we used the American Community Survey data to highlight that 22 million older adults, so those over the age of 60, weren't connected to high-speed internet. But in this report, we also found a range of inequities that also impacted older adults. So off the slide, you can see there's multiple inequities when it comes to connecting to the internet. If you make less than $25,000 as an older adult, you're 10 times more likely to be offline. If you're a Latino older adult, you're 3.3 times more likely to be offline. If you're a Black older adult, you're 2.5 times more likely to be offline. And if you live in a rural area as an older adult, you're 1.6 times more likely to be offline. Next slide. So keeping in mind that 10 times more likely to be offline, this is when you make less than $25,000 as an older adult. This is why the Affordable Connectivity Program, or ACP, is so important, and we need to keep promoting that program. And I think we have a good idea about what the ACP is, but just as a reminder, it's a government program. It originally started as EBB, Emergency Broadband Benefit, and it helps low-income households pay for their monthly internet service. So it's $30 a month off their internet bill per month. It's $75 a month off their internet bill if you live on qualifying tribal lands. They also have a device discount of up to $100, and the discount is given by the internet service provider. What we are really interested in is USAC data that is available on how many older adults are subscribing to ACP. And at the moment for 50 plus, it is 45%. So that is fantastic. That's a fantastic number. Just to put that into numbers, there's a total of 18.5 million subscribers to ACP, and 8.2 million are 50 plus. But when we think about the households that are eligible for ACP across the US, across all ages, only 36% have signed up. So older adults represent a great number in subscribers, but we need to get more older adults signed up for ACP. I'll also just reference that AARP now have a new map that'll be available after the presentation. If you click on the link there, it'll show you the ACP subscribers per state for 50 plus. Next slide, please. So we reached out to some of our Senior Planet participants to get some feedback on how ACP was going for them. And they kept highlighting that it is the impact of affordability. Affordability is so important to them when it comes to ISPs, to internet service, your internet service bill. And we specifically interviewed Sylvia and Sarah Pio, and they mentioned things like when you live paycheck to paycheck, you have to choose what you spend your money on. So we've heard that ACP, we've heard that an internet service in your house is as important as electricity. So when you think about what you have to choose between, paying your phone bill, paying your internet bill, ACP is very, very important. Sarah Pio says being able to use those savings on other aspects of his life is incredibly important as well. So what we have been sharing is a participant provider list that's available through the FCC. that shows ISPs that are currently providing $30 or less plans. So it's effectively making the program $0. Next slide, please. So we have a range of different resources available for ACP that you are welcome to share with your community, and we strongly encourage that. It's centralized on our Senior Planet ACP page. It has a step-by-step guide, it has a video, it has links to our ACP classes, and they're both available in English and Spanish. Our 2 ACP classes are taught virtually and in person at our Senior Planet centers and Senior Planet licensing partners. And we also have a dedicated ACP hotline number as well that you, an older adult, can feel free to call in and get questions answered about the ACP application or be transferred through to the FCC. Next slide, please. So I just want to end our segment with a report that we did last year called the Fly Like an Eagle report. And this report really underscores the importance of pairing not only internet access, but with device adoption and digital skills. So we've covered internet access here today, but we want to underscore that devices and digital skills training are as equal when it comes to digital equity. So the report was the result of a Connected NYCHA project, a New York City government program in 2020 to distribute 10,000 iPads to older adults living in public housing, or NYCHA, New York City Housing Authority residents. And OATS was charged with training those residents how to use their iPads and through a program called Android Essentials. So as part of that program, we conducted a case control study on that particular project, and we found that 50% of the case participants that had done the Android Essentials program made a new social contact, whether that was through email, that was online. 60% of the case participants participated in something new. So this was almost double the rate of the control group. And then finally, social connectedness with existing family was also up by 20%. So I'm happy to share that report within the chat, so you can feel free to have a read offline. And next slide, please. I just want to say thank you again to US Aging and Engaged for inviting us here to speak today. Feel free to use these links here to peruse through our resources that are available, or feel free to reach out to Alex or I if you have questions offline. And I will pass it over to ATAP. Thank you very much.
Good afternoon or good morning. This is my name is Audrey Bush. I'm the Executive Director of the Association of Assistive Technology Act programs, and Linda Jaco and I, who also works for the Association of Assistive Technology Act programs that we call ATAP, will also be co-presenting with me today. Next slide, please. So ATAP is an association. We represent Section 4 of the Assistive Technology Act, which is a federal statute. And we represent AT Act programs that are located in every state and territory in the country. We essentially facilitate the coordination of state and territory Assistive Technology Act programs nationally, in order to coordinate all the national network that we have. Also, and Linda is here representing this arm of ATAP, we also provide technical assistance and support to AT Act programs throughout the country through the Assistive Technology and Training Technical Assistance, which we call the AT3 Center. And the AT3 Center is funded by the Administration for Community Living. Next slide, please. So according to a recent U.S. News and World Report survey from 2023, by 2034, for the first time ever, there will be more adults aged 65 years and over than those 18 years and under. And with an aging nation, the survey revealed that adults 55 and over, there is an increase in incorporating health-related technologies into their daily routines, with 49% reporting this is for general aging reasons, 28% for mobility impairment reasons, 22% for hearing impairment, and other catalysts for using health-related technologies could include vision and cognitive impairments. Next slide, please. With the increase in use of those 55 or older using assistive technology, the increase in type of AT used is attributed to medical or health-related mobile apps, wearable or health-related trackers, and even an increase in use also likely linked to the pandemic in things such as grocery apps and food delivery services like Instacart. Next slide, please. And while we know that the pandemic brought more individuals who are aging online and adopting new technologies, there are still barriers to the use of these new technologies. And the things that matter most to the users when adopting these new technologies is that they're easy to use, they're easy to set up, they're accessible and wireless. Next slide, please. These new technologies are improving those who are aging's quality of life, and they also allow them just to age in place. While most do want to age in place, factors that complicate this are the increased cost of living, along with privacy concerns related to these health-related technologies. Overall, however, it is clear seniors will continue to use technology and increase this use over the course of future years to aid with aging in place. Next slide, please. And now I'm going to pass it off to Linda to discuss ATAP programs and the services they provide.
Can you hear me? It's not bringing.
Yes.
Okay,
yes, we can hear you.
I'm sorry, it's
and
not.
see you.
It's not popping me up, and I apologize for that. So I'll just go ahead and talk. Thank you, Audrey. It's a pleasure to be with everyone today. As Audrey said, I'm now going to give a more in-depth look at ATAP programs and what they do. Firstly, to talk about AT, I think we skipped a slide. If you could go back one very quickly, I just want to explain what AT is. It's actually any item, device, or piece of equipment used to maintain or improve the functionality of people with disabilities, allowing them to be more independent in all settings: education, employment, community living. And this is a definition as explained in the current Assistive Technology Act. So basically, we're talking anything that allows someone to do something they wouldn't otherwise be able to do without the benefit of the assistive technology. We're including no tech, low tech, mid tech, high tech, any and all. And part of the definition that is equally as important as the device is the services that accompany it in order to get the correct selection of the device, the acquisition, and the use of those items. Next slide, please. So what do we mean about assistive technology? Well, there are 10 nationally recognized AT categories. I'll quickly read through them: computer access, daily living, environmental adaptations, hearing, learning, cognition, and development, which also includes reading, writing, math, and organization tools, recreation, sports, and leisure, seating, positioning, and mobility, speech communications, vehicle modifications, and last but not least, of course, vision AT. Next slide, please. So I'm quickly going to share some slides with some pictures to give you an example. So computer access, colorful, large keyboards; daily living, medication management devices, things that assist in pulling socks on and off. Next slide, please. Environmental adaptations would include things like ramps and thresholds to help people in and out of various buildings and homes, lamp adapters, hearing. Of course, we all need to be able to hear when the smoke alarm goes off. So there are specialized AT items for this. Noise canceling headphones. Next slide, please. Vehicle modifications, helping individuals with various disabling conditions to get in and out of vehicles. Vision, CCTVs that enlarge, anything from reading, knitting, playing cards, whatever it is you want to be able to see better. And of course, the obvious signage, dates, and time information such as that. Next slide, please. So what are the core activities of these 56 ATAP programs that Audrey addressed that are funded by the Department of Health and Human Services through the Administration for Community Living? There are state level activities and state leadership activities. State level activities help an individual to access devices through demonstrations where staff compare and contrast the features of devices so that an individual with a disability can make an informed decision to determine whether or not that equipment might meet their needs. Then short-term loans that allow someone to try before they buy for up to 5 to 7 weeks to literally take up to 3 devices at a time in a category or across categories and to try them out to see if it's actually going to work for them as they had hoped. Device reutilization includes 2 different areas: reuse of gently used assistive technology and durable medical equipment. So taking what someone would donate, the ATAP program retrieves, repairs, refurbishes, and reassigns that to an individual for as long as they need it, with the hope that they would then return it. It would again be repaired, refurbished, and reassigned to another individual who would benefit from it. An exchange is a one-to-one person classified ads, where if I had a device that I no longer need, I might want to post it, and ATAP programs do this for us and allow people in the public to connect with the person who wishes to donate and or sell at a very reduced value. State financing activities are activities that allow someone to take advantage of a low interest loan, cash loan, if they actually do not have a third party funder, and the only way they're going to acquire the needed assistive technology and or durable medical equipment is through a cash loan. Digital accessibility is referring to the fact that we ensure that all documents and websites are fully accessible so that individuals who don't have that access will have equal timely access, just as those who do have access. And then there are state leadership activities. How does one find out about all the cool state level activities I just explained? Well, that is done through information and assistance lines, training opportunities, and a lot of different public awareness events that take place on a regular basis. Next slide, please. This just gives you a quick recap with these fun little icons or emojis that tells you in short shrift that device demonstrations let you see, touch, and try to help you make a decision. Device short-term loans let you borrow to try before you buy. You determine if it will meet your needs. Device reutilization, you can keep that gently used AT or durable medical equipment to use for as long as you need it. And financial loans that allow you to purchase your own AT with a low interest loan and extended terms. Next slide, please. So these services are provided through almost all 56 programs. In a few instances, an ATAP program may not provide one of these simply because there is another service within their state or territory that's already doing so, and we're not trying to replicate or duplicate the federal funding. Provided next is a directory that would allow you to connect and directly find out more about your state or territory and how to contact them. Next slide, please. Again, this just recaps what can be done with regard to device demonstration, to see the similarities and differences between devices, to help someone make an informed decision and determine what works best for them. Next slide, please. Device short-term loans, again, letting people borrow before they buy, try before they buy. Typically, this is for 5 to 7 weeks, and you can access what an ATAP program would have available in their device inventory by going online to check it out. Next slide, please. Reutilization, again, this strictly occurs for based on donations, donations from me, you, and anyone else that has equipment they no longer need. Perhaps they've outgrown it. Perhaps a loved one has passed away. Perhaps, you know, they just had the equipment for a rehab situation post-surgery and they no longer need it. This then can be donated for others to benefit from. Next slide, please. Again, the state financing activities, they are inclusive of several different categories. The low interest cash loans that I mentioned. Also, a number of ATAP programs do a lot of 3D printing and provide 3D printed AT for free or very inexpensively. And of course, AT fabrication. Next slide, please. A few examples of items that individuals might get through an ATAP program, through the reutilization or other means, or through a low interest loan. The ramp systems, the tubs that have become so popular lately, lift systems, that can be installed in someone's residence that would allow an individual to still engage with others and live as independently as possible. Next slide, please. Explore AT is a resource on AT3's website, which is very, it's a clearinghouse of information that provides interested individuals with case studies, goes across the lifespan and in all environments, tips, financial funding. It includes videos, links to other equipment and resources. It is just a plethora of different information. And again, the link is provided there for you to explore AT when you have time. Next slide, please. AT Access is a soon-to-be searchable database that would allow an individual to check out various AT products. It has an algorithm, so it will be available this fall. Please check back on our website to see and check it out. You could enter, for instance, if you're looking for yourself or a caregiver is looking on your behalf, you would enter the individual's disabling conditions, what their age is, what their circumstances are, and then this searchable database would pop up with many different suggested pieces of AT, the manufacturer, the price range, etc., that you could begin to explore further. So in other words, it's going to walk you through on a searchable database that which, you know, you wished you knew this months before, and now you can find it out in just a few minutes through this database to see what might be appropriate AT that you weren't aware of that could assist you and help you to live more independently and have an improved quality of life. Next slide, please. So how might you partner with an ATAP program to better serve older adults? Well, there could be ways to access appropriate AT as they live age in place in their home or assisted living residence, ways to make it easier for them to find what kinds of AT could help them when they're visiting with family or friends, and or ways to make persons more accepting of AT as a way to help them to enjoy their communities when they volunteer or socialize. Next slide, please. Again, more information, best next steps, how to connect with us. The link is provided. The name and contact information of those in your state or territory are on this site. The program website can show you how to access the ATAP program services in your area, or you could simply reach out to the AT3 Center and we could provide an introduction for you. Next slide, please. Again, Audrey and I have enjoyed being here with you and will be available for questions now or later if we don't have time to get them all answered. It was a pleasure being with you, and I'm now going to hand this off to Ethel with the Baltimore County Department of Aging. Thank you.
Good morning, everyone. It is certainly my pleasure to be here. Thank you to US Aging for this opportunity. It's my pleasure to bring to you a snapshot of what Baltimore County, Maryland Department of Aging is doing to bridge the digital divide. Next slide, please. Baltimore County Department of Aging is a small area agency on aging in Baltimore County, Maryland. Our mission is to strengthen lives by services, programs, and connections to resources. As many of you have probably done coming out of the pandemic, we flexed our mode of operation, and that included trying to become more virtual so we can increase the opportunity for older adults. Our leadership here in Baltimore County made an official digital inclusion initiative at the end of 2022 for us. Next slide. As our agency started to approach this, we thought we would do a three-pronged approach. We would look at how we could provide devices, resources, and training. Next slide. For those with means in education, it's really easy to understand how technology can be a big plus, but there are a large portion of our county that do not have the access to technology. Alex, in his presentation, utilized this quote that 22 million older Americans lack internet access. We also found that the Black and Latino older adults are respectively more than 2.5 and 3.6 times more likely than the general population to lack computer access. Next slide. So, you know, the county is also putting emphasis on increasing broadband accessibility throughout the rural part of our county. But what, as a Department of Aging, could we control? And that would be helping low-income older adults get devices in their hands so they can live connected. So we were able to utilize some ARPA funding that we received from the federal government, as well as we applied for grants to have 320 Samsung tablets. We've given out 250 Apple iPads, and we've given 300 of our 600 Chromebooks that we have to give away. In fact, just 230 went out this week through distribution events that we've had. All of our giveaways were based on being below the 200% poverty line, and that means $28,170 annually for an individual. And as you can imagine, if your income is such, you would finding a device that you could afford would be cost prohibitive. And, you know, our giveaways are one of the few ways that they would be able to get something in their hands. Next slide. As a sidebar, as we were going through the application process for the individuals receiving the devices, we found that many of them do need access to other services, whether that's financial assistance programs like affording their medications or food resources, transportation, home repairs that some of our partner agencies do for low-income individuals. We were able to make that connection. So that was a big benefit to the application process. Next slide. At our device giveaways, we have one-on-one appointments. We set up their device. We set up their email. We give them a training of how to use the basic features of the device they're getting, as well as a handout to use later. We connect them with resources. We have tech support and training I'll talk about a little bit later. And lastly, we screen them and help them apply for the Affordable Connectivity Program. At all of our events, our staff is either there doing the screening, or we've been able recently to have county digital navigators that are there to help them walk through the process of online application. And then we also have been lucky enough to have internet service providers at the events. So when they qualify, they can go right over to their table and either apply the benefit to a bill they're paying or set up installations. So really when they leave, they walk out with a device, connectivity, and installation ready. Next slide, please. I'm sorry, I covered that before. Keep going. Next slide. The next thing we took on, our second priority, was tech support. Knowledge about technology is also is important in expanding capability for older adults in the communication. As many as 77% of older adults that have a device to use report that they would require assistance where they try to learn how to use it, according to a Pew Research study. Next slide, please. So what we have been able to do is set up virtual tech support by Zoom or phone weekly, and then also in-person tech support at various senior centers around our county where people could drop in between 9 and 2 to get support. Next slide. And our tech support, obviously, we do not have the staff at our Department of Aging to be able to do that. So we've been able to partner with local colleges to have internships that would provide the tech support. We've worked with our workforce development department where they can stop into career centers to get support, and also public libraries where they have an Ask a Librarian program, and they can either walk in or do on appointment base. Next slide. In thinking about tech support, I just want to let you know it's important to be prepared to face the challenges. They could walk in from anything from a smartphone to a iPad to a Chromebook, and you need to be able to be knowledgeable. Answering questions ranging from privacy setting in Facebook all the way up to how to upload a book they've written to their printer's website. I will say that you can Google just about anything, and it's really easy to impart that knowledge onto the other person on the other line. And you're also dealing with a broad spectrum of people. Next slide. So the third priority we had was training, and that research indicates that 65% of older adults indicate they need more training to feel confident to use their technology. Many of the challenges that they face are they're just unfamiliar. They didn't grow up in the world that we do today with technology surrounding us at every corner. They've heard a lot of negativity about social media. They are fear and anxious of identity theft, scams, just the bad things that can happen on the dark web, and then their physical changes. They need to be able to address whether they're hearing, vision, dexterity, memory, whatever it might be. And, that's something that we do during our setup sessions with handing out the devices. If they have, need the font to be larger, the settings to be different, the shading to be put it in a different language so they're able to read and utilize their device. Next slide. When we started the training, we paired with University of Maryland Extension 4-H, and we had, during the summer, their summer youth employment program provided high school students that developed curriculum on various topics, and they presented 5 weeks during the summer. It was very popular, I think mostly because they felt like they were learning from their grandchildren, so they didn't hesitate to ask good questions back and forth. The only challenge was that high schoolers have limited availability once they went back to school in the fall, only on holidays or weekends, which our department wasn't functioning. Next slide. So like Alex and Ellen spoke about earlier, we became a partner of Senior Planet with a licensure there. We're partner sites. The curriculum that they provide is very easy. Our staff that are not tech gurus by any extent have been able to be trained through Senior Planet. We also have a volunteer that's out there giving classes. It's straightforward. I would encourage anyone to think about that. Each quarter of the year, we are offering about 75 classes throughout the county. Next slide, please. And the way that we were able to build the capacity is through partner building. As you can see in this slide, we partnered with the Workforce Development for their Mobile Career Center. It's a mobile unit that has 16 PC stations in it, and it makes it really easy to pull up to any location. We have gone to senior housing, we've gone to faith institutions, we've gone to community centers, and it's been a blessing that way. So I encourage everyone that's thinking about it to kind of think outside the box of what you are able to offer. Next slide, please. Our training has reached a wide variety of people within our county. We have 53% were white, 44.9 were Black or African American, and we do not have too many other minority groups present within our community. Next slide. I think the success stories in these pictures kind of show it all. The older adults love at the end of the 5 or the 10-week program, we host a graduation where they get their diploma, and they are super proud that they get to walk up there. The quotes on here are amazing to me. You know, with the tools I've learned in this 5-week course, I'm confident to sign up for online college courses to finish my degree 40 years in the making. That's pretty substantial. And someone said that she's more proud of this diploma than she was of her high school one, because she chose to do it and she stuck it out by herself. Next slide. So what we also needed to think about was how we could make tools for older adults now that they had some training as to they could safely get online. So we developed a 21st Senior Center called the Opal Center here in Baltimore County, where you can log in to have a wide array of programming, as you can see on this slide. It's completely free, and it's for 50 years of age and older. Next slide. We also partner with the Get Set Up program, which offers about 300 virtual programs a week where they can continue to practice their skills and still get some valuable programming. Next slide. We have a Facebook page we post about 4 times a day where people can get connected to different things. We can tell them also about current scams that might be out there and trends. We currently have about 3,000 followers that are there. We do live stream on our Facebook page about Medicare, about caregiving, all sorts of good topics as well. Next slide. We opened a BCDA YouTube channel. So some of our great programming that is available now on demand for classes and lectures in Baltimore County. Next slide. And we do a Tech Tools e-newsletter. So it gives them practice on their email, has hot links on it so they can sign up for classes or learn about different resources. And that is really an overview of what Baltimore County has been able to do. I rushed through because I know we were running out of time. Last slide, please. You know, we are not experts on technology. We have regular full-time load of work here in the department. And I think the message is that anyone with the right partnerships and excellent attitude and skills will be able to deliver the resources to older adults to help them with their digital equality. And once again, thank you to US Aging for this opportunity. And I'm going to pass it back to Meredith.
That was a great note to close on there, and really thank you to all the presenters. I know, yes, we will be tight on time to have a lot of time for questions. So presenters, all of you, if you don't mind sharing your contact information in the chat, I know that's one thing people will ask for is how can I connect and, you know, kind of ask a particular question I may have. So if you feel comfortable placing that in the chat, please feel free to go ahead and do that. But I did want to highlight a couple of resources. Engaged in OATS, as I mentioned at the top, have been partners on this line of work for a number of years. There are a few different materials we have all available on the Engaged website. And we're also working on a series of fact sheets focused on online safety, and those will be coming out in August. So keep your eyes on our site, sign up for our newsletter if you're not already, and you'll be able to learn about those resources too. Next slide. And this one just highlights a few additional resources through Engaged, with some of our newer ones. We have a intergenerational piece that's focused, that's a consumer focused piece. We have a new best practices compilation, and then some of our ongoing resources, our social engagement innovations hub, an online clearinghouse of innovative programs, our toolkit, our videos, our newsletter and blog. You can find out all of that, find links to all of that on our website, again, engagingolderadults.org. Next slide. I did also want to highlight Commit to Connect, which is another initiative funded through their through the Administration for Community Living, also focused on promoting social engagement across all populations. Engaged focuses on the Aging Network and Aging Network partner organizations. And Commit to Connect has a variety of initiatives and online hub for champions, people interested in addressing social isolation and loneliness, forum for folks to connect and engage and undertake a variety of other activities as well. So would encourage you to check out the committoconnect.org website. US Aging does serve as the coordinating center for that effort. Next slide. This just highlights a Commit to Connect upcoming webinar, another learning opportunity. There'll be a webinar on August 1st, highlighting innovative volunteer models that promote social connection. And you can find the registration information on the committoconnect.org website. But with that, I'll invite the presenters to come back on camera, and we do have a few minutes for Q&A. And thanks for sharing so many questions in the chat. I think since we are a little bit limited on time with Q&A, I just wanted to start by asking a general question, and we'll see what if we have time for more questions. But and we'll just maybe go in order of kind of organization. So we'll start with OATS. But if you had to share one key takeaway that you want to make sure folks did not miss from your remarks on this webinar, what's that key takeaway or key resource or website that you want to make sure folks have access to? So Alex and Ellen, we'll start with you.
Yeah, I think probably seniorplanet.org, where all of our virtual programs are located, and the information for our contact center, other resources are there. And I think a lot of the stuff that Ellen was talking about is coming soon, but there's a lot of great information on agingconnected.org as well. So both of those websites.
Okay, super. Let's go to the ATAP program, Audrey and Linda.
Linda may be having some technical difficulties, but
It says the host has stopped my video. I can't, it will not let me. I've tried numerous times. Sorry, I'm here, but
We hear you, so that's good. We can hear you at least. And I'll try to get your video on, but feel free to chime in.
Go ahead, Audrey.
So in terms of resources, it's at3.center. We can put it in the chat, the email address for the myriad of resources that are there.
Good. And Ethel, any key takeaways that you want to make sure folks heard from all that great information that you shared?
I would just encourage people to think outside the box, connect to resources that are available like Senior Planet, ATAP, all of the above, as well as, looking at your local network and where can you extend your reach.
Thank you. Okay, let's dig into a couple of the other questions that came in. So this one goes back to Alex and Ellen pertaining to the Affordable Connectivity Program. Somebody asked if there's a sense of how long it typically takes, and I'm sure there's some variance, but from sign up to ready to use. So I guess from sign up to you are connected. And are there, I think this ties back to Senior Planet, but how can we help people with digital literacy skills?
Well, I'll take the second part of that, and then Ellen, we're having some internet connection issues in our office, so I think Ellen's on the phone, so maybe she can chime in about the first part if she's here still. The digital literacy skills, definitely through our website, seniorplanet.org. There's a ton there. We do everything from the basics to very advanced. If virtual is a barrier, getting online is a barrier, our contact center can help get people onto the virtual programs. And then if you're local to one of our licensing sites, which you can find on the website as well, or one of our Senior Planet centers, we do a lot of foundational work there. And Ellen, are you here? Did you want to take the first part of? Looks like she's here, but maybe muted. I don't want to misspeak for Ellen, but the connectivity process it depends. You have to go through the verification process, and it can be a little clunky and cumbersome. But I think what we're usually seeing is 2 to 3 months from kind of going through and getting, the application and verifying your income and all the other credentials. People can get connected and start getting the benefit from their internet service provider.
Okay, that sounds good.
Thank you,
Oh,
Hey,
Ellen, is that
everyone.
you?
Yep, there you are, Alan.
Sorry about that. I'm just on the phone. Yes, as Alex mentioned, we usually find that the application process will take between 20 to 60 minutes to sign someone up, and then they'll see that benefit about 2 months later from the internet service provider. Thank you.
That's great. Well, we are at time, and I want to respect the speaker's time and attendees. I know everybody's busy, but you have contact information. We will share a recording of this webinar. We will share the slides. They'll be on the Engaged website. You'll also get a follow-up email with those links. So, so there will be ways to get any questions that you want answered, and also access to this information in case that's helpful. So there is a brief poll that will pop up on your screen as we close out of the webinar. If you are able to do that, we really appreciate feedback. We also do a 3-month touch point to just see any kind of longer term learnings that people take away from these learning events. So if you see an email, which you will in 3 months, it'll be really short, and we appreciate you taking a couple minutes out of your day at that point to share your feedback. So with that, I will thank again our presenters and thank the attendees who carved time out of your day. And I hope you have a great rest of your day. And thank you, everybody. Take care.